Let's take a look at this easy integrity and honesty question from the situational judgment test. So the scenario is that a patient confides they're using recreational drugs but begs you not to document it, fearing judgment from their family. What's the most appropriate and the least appropriate action? Let's read through all three first. So explain why documentation is essential for safe care but offer to discuss confidentiality protections. B. Document generically substance use without specifics. Or C. Agree to omit the information to maintain trust. These questions I often find it's easiest to identify the least appropriate action, and usually it revolves around doing nothing. So C would be the least appropriate. By not documenting it, this could potentially impact the patient's care and their treatment plan, and it also violates your professional obligations and risks their safety. Now, the most appropriate action is going to be to explain to the patient why the documentation is essential and then to discuss the confidentiality protections. This addresses the concerns of the patients, it balances honesty with empathy and professional duty as well. So this would be the most appropriate, with B being a null option. By just putting generics into the just documenting generic phrases without specifics, this could perhaps impact patient care. Let's take a look at this medium level difficulty integrity and honesty question from the situational judgment test. During a night shift, an FY1 prescribes antibiotics for a patient with a documented penicillin allergy. The nurse points out that the prescribed brand contains penicillin. The patient has already taken one dose but shows no reaction. How appropriate are the responses? A. Immediately informing the patient, documenting the error and reporting it via the hospital's incident system. Absolutely, this is the most appropriate. This is exactly what the foundation year doctor should do. It prioritizes transparency, it prevents any further harm to the patient as well. Just because we've made a mistake, we should not prioritize our own concerns over the concerns for the patient. Not sharing the information with the patient as well could also damage the patient-doctor relationship and undermine the trust that the patient needs to have in the care of the doctor. B. Switching the medication quietly and monitoring the patient closely without documenting the error. This is inappropriate. It undermines that trust, but it's not awful because we have still addressed the patient safety and making sure that they are not going to have any reaction. It lacks accountability. C. Dismiss the nurse's concern, stating the dose was too small to cause harm. This is very inappropriate. This risks patient safety. It also undermines honesty and the integrity of the foundation year doctor. This could cause serious damage to the patient's health, and the doctor should take responsibility for that. D. Ask the nurse to document the incident while you check the patient's notes. This is appropriate. It ensures that the incident is taken seriously, but it does not, the doctor themselves is not taking responsibility for that incident. It also means that there's perhaps going to be a delayed response as well, and patient safety might be at risk. Let's take a look at this hard situational judgment test question relating to integrity and honesty. The scenario is that a consultant asks you to backdate a signature on a form they forgot to complete last week. The delay was due to their workload and no patient harm occurred. How important are the following factors in deciding how to respond? A. The legal implications of falsifying medical records. This is very important. Fraudulent documentation causes serious consequences. This leads to undermining the integrity of the medical profession, the honesty that is involved in taking personal responsibility within the profession as well. B. The consultant's seniority and your reliance on their support. This is of minor importance. Now, the reason it's of minor importance is because the hierarchy should never should never compromise, it should never override personal integrity and professional integrity as well. Now, the hierarchy within the teams, within the work teams that you will be working in is important, and it is important that that hierarchy is respected, but it should still be able to be challenged in the appropriate way. C, whether the form affects the ongoing patient care. This is an important consideration. Even though we are told that no patient harm occurred, if this mistake continues and if this causes a reduction in the care of the patient or affects the care later on down the line, that is of big concern. And then D, the consultant's assurance that it happens all the time. This is not important at all. Normalization does not justify misconduct. You see points like this come up quite frequently in the situational judgment test, and it's really important to remember that just because it's happened before does not make it okay for it to happen again.